everyone. I am Dr. Rana Mondal, one of the mentor in the StudyMEDIC platform. Welcome to our dedicated session on the core surgical skill module for the Part 3 examination. It's my pleasure to invite all of you as we embark to the journey of the last stage of MRCOG examination. And this is the where you need to demonstrate your surgical competencies and communication skills to the examiners. Understanding part 3 framework is a key important. Each module is very important and the core surgical module is extremely important as it is a very high scoring area as well. Usually you guys going to have several cases and one of the topic for sure will become from this module. So you cannot miss this. And as usual, they will be assist you on the 5 domains of the patient safety, communication with the patient and colleagues, and in gathering the information and your applied clinical knowledge. So moving on to the next one, what are the core surgical modules topics you need to aware of? What kind of things you need to know for this? Each station will be lasting for 12 minutes and 2 minutes will be given time from outside of the cubicle, where you need to know everything and read everything carefully, including you need to read the domain where you are going to be assessed. It's a very important. Most of the time, they will provide you either a simulated patient task or a simulated colleague interaction. Engaging with an actor trained with portraying specific scenario, focusing on your communication, interpersonal skill, and patient safety and applied clinical knowledge. They can also give you a structured discussion, which is not uncommon in the core surgical module, where there will be interaction with the clinical examination to discuss the clinical scenario, emphasize on your applied clinical knowledge and patient safety. And sometimes there can be teaching modules also. And most of the time, this assessment focuses on the pre-operative assessment where you need to take the consent and counsel the patient and tell them what are the risks and how much as the risks are there. And you need to know all the consent forms very detail for this module. Another important thing is during the operative procedures and intraoperative complications they can ask you often. And another important thing is the post-operative period and enhanced recovery assessment. So you need to aware of all the 3 parts of surgery involved, from the pre-operative consent and counseling taking to the intraoperative complication and management. Sometimes they can provide you a basic surgical skill. They can ask you manual vacuum aspiration techniques and methods, indications like that. Sometimes in real scenario examination, they can provide you an instrument and ask you to demonstrate the procedure as well. So I have already discussed regarding the type of the station. The first thing you need to aware of the simulated patient task. And in the simulated patient tasks, most often are assessed on all the 5 domains in the surgical module. And often you guys have a lay examiner also. Most often they will ask you in the simulated patient task to take an pre-operative counseling or a consent taking, and that where you need to demonstrate your communication skill not only with the patient, also with the other colleagues and other multidisciplinary teams also. You need to explain the surgical procedure and its risk, benefits, and what are the alternative options are there. Often candidates miss this, the alternative explaining regarding the alternative things, methods they can have. For example, in cases of miscarriage, you just need to know what you're thinking the best. You need to give all the options like expected management first, then the medical management, then the surgical management. Then you need to explain everything in brief regarding each of the options, their benefits, their risk, and their complications. Sometimes, often, you guys going to have a structured discussion. Structured discussion is very common from the core surgical module. Most often they give you a demonstrate or to there will be a complication related scenario like an bowel injury, gut injury, or bladder or ureter injury scenario during an hysterectomy or during a cesarean section. You need to demonstrate the surgical approach and what also you need to demonstrate your decision making and the multidisciplinary team attachment also. And most important for this kind of, you need to do a risk assessment, and at last there should be a clinical audit you need to perform, and you need to show the patient your duty of candor as well. Sometimes in examination you can also guys get and practical demonstration tools where you need, they will providing some instrument. They can either provide you a varus needle or any other laparoscopic instrument. They can give you an MVA instruments and ask you to demonstrate, and some basic questions regarding that they can ask you. Now I will be moving on to showcase you guys three module, three case scenarios from these core surgical modules, and these are the very important which are the often asked in your examination. So this is the first scenario. This is a scenario, please, you guys going to have a 2 minutes time during which you need to read this document very carefully. Sometimes there can be a lengthy documents also. If you can't finish within the 2 minutes, then you can politely ask for another minute or two. And please when you enter or start the examination, go through all the things before starting. It's a very crucial. So here in this station you will be provided a scenario or list of the patient where you need to demonstrate your competencies and communication skills, also your applied clinical knowledge and patient safety. Here you need to demonstrate very importantly how your leadership skills as well. Leadership in the sense you need to do a triaging method as well here. It's a very important. So first is this station is kind of similar to the labor ward station where you need to prioritize according to the patient's condition, and you need to assess and you need to inform your consultant accordingly and accordingly plan the operative theaters. Please try to go through this in a break, and so you will can understand and try to solve it on your own before proceeding. So there will be a here there is a 10 scenarios where you need to prioritize accordingly. Now in your real examination you may have more than these cases also. It is not always important to complete all the patients, but you need to complete the majority of the patients and demonstrate that you have the leadership skill and triaging capabilities. It's a very important for this kind of scenario. So such kind of scenario, what you will do, how will you proceed? Here you will need to proceed in a three basic structure way. First go by on your own through the patient wise and see what surgical procedure demands it, and accordingly surgical procedure demands it, classify it accordingly: emergency basis, urgent basis, semi-urgent, or in a routine procedure basis. And according to surgical method you're going to perform, you can choose the setup. Either it is an emergency procedure, emergency theater, or it is in a ambulatory clinic, or either it is in an inpatient admission and elective operative theater you need to perform. You need to aware of what are the emergency conditions. You need to aware of what are the urgent. That means we need to perform this around the within the 4 weeks. You need to aware whether it is in cancer pathway, and for routine elective operation for benign condition, you can choose a routine care pathway as well. After that, you need to ascertain the venue, and whenever you have decided anything regarding surgical procedure, especially if you're performing surgeries like myomectomy or anything like that, you need to take consider of the alternative option. Also think of the risk assessment, the fibroid, their blood product requirement assessment, whether any other adjuvant therapies are required or not. So here is the key. You can see that here I have classified accordingly the basis of what type of surgical procedures are important. So keep in your mind that first go through the patient. Like here, there is a nulliparous patient with a 18 centimeter fibroid uterus. Of course, in such patient, you cannot do anything other than the myomectomy. As it is a nulliparous, she will require a myomectomy. This is a very important. You need to choose the correct procedure you need to going to perform for the each scenario. Now, this is a fibroid. Of course, it is a non-urgent condition. It doesn't require any adjustment at present. You can wait up to 18 weeks or sometimes or after your routine care you can provide her for this time period. Meanwhile, you need to optimize her health condition, whether she is anemic or not. You need to check for her other blood investigation, whether any blood products will be required or not. And also for a nulliparous woman, it's important to have a fertility assessment before doing a myomectomy. The next case scenario where it's a 47-year-old female with a left ovarian mass, which is around 9 centimeter and Ca125 is 51. You need to counsel this patient accordingly what she needs, whether her fertility has been desired or not, whether her family has been completed or not. If not completed, cystectomy is likely the usual options here. If first of thing for any patient with an ovarian mass, as you need to do, first thing you need to do is the RMI scoring. Is the first thing you need to do. And according to the RMI scoring, you need to ask those patients in which setting we are going to perform it. So please remember, whenever you see a cyst, first do the scoring, then proceed with the management. The next patient is that there is a heavy menstrual bleeding patient wants for Mirena insertion. She is a known case of epilepsy. Of course, she is not at present bleeding correctly, or meanwhile, when you have put her on a Mirena and can be done in an ambulatory basis or outpatient basis can be done, and it's a non-urgent scenario routinely can be done. If she is heavy bleeding at present, you can do the pharmacological management for few times. Now, in the next scenario, as well as a 16-year-old female having an imperforated hymen and she is having hematocolpos. Of course, she will be presenting with here in cases of the pain is the most common way to present in cases of where hematocolpos is there. So this is an urgent condition and you need to do an hymenoplasty in an emergency basis here. If so, emergency full workup required regarding the blood transfusion needed or not, depending on the how much she is anemic or not. You need to do an ultrasound also before proceeding to rule out any kind of Mullerian abnormalities here. Where in the next case, there is an para 3 with living issue 3, previous cesarean section for lab sterilization. What you need to do here, she is planned for the lab sterilization procedure. It is a routine procedure, non-urgent. You will be performing her. This is a non-urgent case, so it will be need to show in the later. Now, and the next case where is a nulliparous chronic pelvic pain severe dyspareunia patient where is a diagnostic laparoscopy. This is also a non-urgent or a routine care procedure where you can perform in a routine after within the 18 weeks pathway, preferably or after when the pending operative list has been completed, you can put her on. Next one is a complete molar pregnancy at 18 weeks. Of course, molar pregnancy usually presents with a bleeding and it's an urgent case and you need to do a suction curettage on urgent basis. Molar pregnancy always need to be an inpatient management is always preferred and don't forget to register with a GTD center for a molar pregnancy. Now, next one is a low-grade dyskeratosis and HPV positive. Of course, you need to follow the colposcopic pathway as per the IMG's guideline. The next patient is a 71 years old with prosidentia with history of angina and known case of diabetic mellitus or hypertension. So she has a lots of comorbidities and she is 71 years. This case is also prosidentia is not an urgent unless there has been any compaction effects are present. So prosidentia can be managed conservatively or either in these cases you can do colpoclasis also if it's not manageable with the pressure. Okay, so colpoclasis is a very good option in a old friable woman who have multiple comorbidities. But colpoclasis also remember require an inpatient management. But in cases of procedencia where you can provide with a management or temporary relief with a pressure, you can do in an ambulatory settings also. Now, next patient is a postmenopausal bleeding with breast cancer, history of breast cancer, and also she is on tamoxifen therapy. Of course, what you need to do, and first thing for postmenopausal bleeding, you need to do and endometrial biopsy sampling, and according to that, you need to manage. Remember here, the primary procedure is the biopsy sampling, so it can be done in an ambulatory setting. Okay, according to the biopsy report, further treatment will be managed. So coming to our next station. So next station, the first station where I have described will be discussing your leadership skill, your communication skill, and your applied clinical knowledge and patient safety points will have been assessed. Here in this scenario, they had given a structured discussion method. Yes, given. In this structured discussion, please first, before entering into a station, look at the which are domains you are going to be assessed. Here the domains are the four domains: the communication with the patient, communication with the colleague, patient safety, and applied clinical knowledge. So information gathering point is in there. So don't put much effort on the information gathering here. Often structured discussion are quite simple and straightforward if you know the things. Here, the scenario given is that an specialist registered in ONG while undertaking an gynecological operation. During the operation theater, she was performing an hysterectomy. During the hysterectomy, there has been an injury of a right ureter when she was putting a clamp during the uterine artery where it crosses the cervix. So what you need to do, you need to have a basic understanding here for the uterine or ureter injury management. Often they will ask you in this format. First, they will ask the immediate management, what, or in the otherwise framing, what is the next step you're going to do for any kind of scenario. Usually, this is the most first question they ask regarding this, and they will then ask you some basic questions regarding the ureteric management, like how to identify ureteric injury, principles of the surgery, what are the management options, what are the post-operative care. So often in a structured discussion, first question comes as your immediate management to see how effective you are in practical scenario. So often the question is the next step of management or the immediate management. So whenever you are practicing the core surgical module, please think it like that. Each of the case scenario, each of the complications, they will be asking you what is the next step or immediate management. Here is the main assessment that will be done. So first of the thing here you need to do is to stop the surgery. If any bleeding, you need to secure the bleeding points. Inform the everyone, and or you need to put the code as it in your surgical team decides. Inform the anesthetic, your colleagues, your senior members. Also, you need to inform the other discipline, especially the urologist also. And you need to you will, of course, if you're in the OT, you will be saying that you're not going to do, you will ask someone to do these things for you. You need to cover the wound area with a gauze or mop and stop the bleeding and secure the area, and so that you can identify it clearly. Whenever there is any injury happens, it's very important to properly identify those areas and stop the aberrant bleeding from the surrounding areas. And the most important key thing is here to inform the patient sensitively. Of course, if the patient is under general anesthesia, you cannot inform her. In that cases, after the postoperative management, you need to perform your duty of candor. But most often in the THBSF, the patient will be in a spinal anesthesia. So you can inform her in that case. So please remember, often, if the injuries are small or depending on the type of the injury, your management depends. Okay, if you need to first assess the ureteric injury, what type of injury has occurred, It's either is a thermal injury, crush injury, transection injury, or not, depending on that. If the injury is very small, less than 2 millimeter or less, usually nothing is required. Conservative management often sufficient. So monitoring the vitals and putting DJ stent and postoperative monitoring is often sufficient for those cases where there has been a major injury has occurred. You need to perform and surgical management in that cases. Now, depending upon the where the injury has been occurred, your repair or management will depend according to that. Of course, the primary repair when it has been injured, if you can identify during the operation, that is the best thing, and you can avoid a lots of complication if you can identify urinary injury during the performing your primary surgery. Of course, you guys will be knowing the type of operations. If it is in upper third, you can do an ureterostomy. In the middle third, if can be mobilized, you can do an either ureterostomy or you can transureterostomy. And in cases of lower third, you need to mobilize the bladder to perform ureteroneocystostomy. Some cases, if it is a major distraction, especially in the lower third, you need to mobilize a portion of the bladder and other areas as well to provide a reimplantation in case of Swasich operation or Boareffi method. You guys will be knowing the basics of principles of the ureteric injury, like an anastomosis might be an watertight, tension-free, speculated or fish mouth kind of appearance. You will be providing not much tension, and it's preferable to give an intermittent suture with an absorbable suture. And you need to do an degestenting. If there is an injury where the tissue has been devitalized, you need to perform an debridement also. Recognition is a depends on the intraoperatively. Here the case has been presented intraoperatively, so you need to tell the examiner's intraoperative management here. So intraoperatively, please relatively, the best way to identify is in cystoscopy, where you can visualize the ureteric jets from on the bladder is present or not. On the injured side, the ureteric jet from the outlet of the ostia of the opening of the ureter will be absent as it has been injured. In cases of sometimes you can see a presence of blood and air from the injury area as well. Also other options are options available like intravenous administration of indicocalamine ureteroscopy or ureteropilography. But please remember when you are identifying intraoperatively, it is only cystoscopy you need to mention. All this procedure doesn't need to be mentioned because it is the only thing you will require during the operation to manage. Post-operative recognition is not important in these cases of scenario. I have already discussed the management option, what are the types of management and what types of surgeries you need. Please remember that whenever you are doing an injury especially during the clamping the ureter, uterine artery when you're injuring or during the putting the McEnroe's ligament or uterosacral ligament, often injury happens in the lower one third. So you need to tell the ureteroneocystostomy SOASH operation and briefly at least tell the name of these procedures. Moving on to our next scenario, I have given you an leadership skill in the first scenario. Next scenario, I have provided in a structural discussion. And this scenario, I'll be providing you a simulated patient task scenario. So in a simulated patient task scenario, always be aware of that you will be assessed on the information gathering, communication with the patient. These two will be mandatory. And regarding the communication of the patient, often there will be a lay examiner in this such kind of scenario to assess you. So it's been presence of lay examination, the scoring will be higher. So please keep in your mind here. So here you can read by on your own. There is in you are undertaking an pre-operative ward round and you are about to talk with an Katie Brown who is scheduled to have a vaginal hysterectomy for grade 3 prolapse tomorrow morning. Your task to explain the procedure to her answer any questions she may have, explain the consent. You have not seen the patient before yourself. Please keep in mind each word is very important here. She was assessed in the outpatient department by your colleagues. You have been able to read her clinical notes, which briefly indicate that she is 54 years old and was diagnosed with grade 3 POPQ prolapse. She has been three children with vaginal deliveries and her husband had a vasectomy 5 years ago. She was moderately severe asthma and stroke, smokes around 10 cigarettes per day but has no other relevant medical history. So please read all the things very carefully. I will tell you one by one as per the assessment criteria and how will be assessed in the each of the domain. I will explain you also here. Please remember few things here in this. First, you have not to know what type of operation you are going to do and for which indications. So in cases of prolapse, you need to know what is going to be performed in her case and such type of procedure you need to know what are the risk, alternative and what are the common risk, frequent risk and rare risk of that procedure. And here is an important thing. Here you can see that you haven't seen her, but your colleague has seen her. So she might be knowing your colleague, she might not be knowing you. In these cases, best to start with asking the patient what you already know. That we can give you save you lots of time here because patient has already seen someone and talked with you. You don't need to start from basics. You just need to ask her like that. I know you are seeing one of my colleague. So how much do you have understood about the procedure? You can say like frame it like that. I will be demonstrating you later. And whenever you are reading the information, go through each of the risk factors like she had, especially the asthma. Here, in case of her, asthma and smoking is a risk factor. Both, and that should be optimized pre-operatively, and precaution should be taken during operation. So the key points here will be a targeted history where you need to explore some risk factors like asthma, smoking, whether she is on HRT, how smoking, how much she is smoking, whether she is able to stop smoking before operation or not, and how whether her asthma is in control or not. If not control, you need to consider a referral to your colleagues as well. Now coming to the each point here, in the first thing where information gathering, what you need to do is that first, always when you are entering into the cubicle, first introduce yourself and then ask gently her name and confirm her age. It's a very important and a patient safety point to asking name of the patient and confirming her age or NHS number, whatever you can do and try it in the first way and like in good morning or good afternoon like that start with an informal way like that good morning this is Brown or like the good morning I am Dr. X I am I am here to discuss regarding that as they can start like that and always show that the patient you are part of a team so you are not alone here. You are not alone treating her. This gives lots of confidence to the patient and often examiners try to explore this. So always provide you that I am one of the doctor in this clinic or like that I am a part of the team looking after you like that you can say. Now it's a very important to see that you are the first time seeing her but your colleague has seen her so confirm her understanding and concerns how much does she already know. Has asked her gently that have you spoken to one of my colleagues as I can see on my notes. So what do you understand so far you understand about the procedure and what are your concerns? So you can put it like that. Now this way you're actually saving around 2 minutes. She will be explaining by herself that I have known this type of procedure, why I'm going. She will be already telling you all of those things. but there will be some concern that you are giving chance to explore the patient. Now it's a very important when you are taking history, you need to go in a systematic manner. So, and this is a very important, you just not going to jump from here and there. Go in a through a systematic manner is a very important, from the understanding chief complaint to history to the risk factors to the past surgical history, past medical history, and how well controlled are that, whether there is a past operative procedure and whether there's any complication after the procedure like deep vein thrombosis, any kind of things are there. So you need to assess in her case. The next thing they need assess is the communication. Please remember in your real-time examination, the examiner will have this kind of points, bullet points where they need to tick it. So it is you will be knowing you have completed this targeted area or not. If you cannot meet the key points they have been provided by the college, then you are not going to give the full marks in that domain. Communication with the patient and communication with the colleague is often an easiest area to where you can score. And of course, going to the basic, please remember when you are doing a communication with the patient, use a simple language and non-medical jargon-free language to be used. Okay, so please go through these basic things and you need to address the common patient concern like that. She can ask you if whether I'm having hysterectomy, whether there will be scar or not. You can understand that she can be having a prolapse of vaginal hysterectomy. So basic things in these cases, they usually the role player will be asking you and you need to inform them politely. And of course, and a sensitive way you need to communicate in this case, and always it will be explored by the college that how sensitively you have explored that the concern, her concern regarding the sexual function and how much reassurance you can provide. Such type of scenario, it's a very important. Now regarding the communication with the colleague, of course, you need to acknowledge that you have already communicated with your colleague and you already know how much the page you have seen the notes. So you know your colleagues has done the basic works. Now you need to assess, as she is a smoking and also asthmatic, you need to assess the anesthetic risk and communicate with your colleague or anesthetic team as well regarding her the anesthetic assessment or the she is in high risk category of anesthesia or not, as she is smoking more than 10 cigarettes per day. And also you need to in such kind of sign sometimes it's important to inform that if she has a long duration of prolapse or very weak cystosil, sometimes you need to may involve an urologist as well. Now the patient safety point, please be aware of the patient safety points, it's very crucial and the most of the candidates get underscore or failed in the patient safety domain. Here the patient safety domain where things you need to do and basic things actually that you need to do. You need to make sure that all the pre-operative measures, all the pre-operative things you have told her, you have assessed her risk assessment, you have risk assessment done for the thromboembolism as well in her cases, and you have advised her smoking cessation also, you have checked her vitals like any kind of fever, difficult urination or present or not present in such type of scenario. If of course if she is having a fever, she is having a DVT risk, you need to assess is a very important. So this type of patient safety point you cannot miss. If you miss, you will be failed in the domain. It's not the patient safety point always means that you the intraoperatively how surgical skillful you are dealing with. The patient safety points, remember, are the always the basic things, basic safety points you need to aware of. Now, coming to our last domain is the applied clinical knowledge. Here, the applied clinical knowledge is a very simple in part 3 examination, not much. You just need to give a brief details and to see whether how much the patient understands regarding the procedure. It's a simple way to put it is that Can you tell me how much you know about this procedure? Explore the patient first, and often this type when you ask such type of question, patient herself will tell you something like that. I have seen this, I have understood this much, but I don't know but I do have some queries regarding that. And then you can address the specific queries she going to ask you. And this is the thing often you guys made. Have seen lots of candidates going through in details of the surgical things and explaining those things to the patient, but those things are not required. Just ask the patient what too much, how much you already know, and what are the things you want to know extra, and what are the concerns you're regarding this. So these are the basic things if you can cover, and often you guys going to cover these basic things, then you guys going to tick all the key area points of these simulated patient tasks. Simulated patient tasks are often easy if you can't hit the targeted areas where the examiner going to ask or examiner is going to put tick. So I have provided you in three scenarios. In one is a leadership skill based scenario where you need to prioritize the surgical theater. Second one is a structural discussion, or sometimes in a structural discussion, it can be a teaching scenario also. There is between a case of rotary injury, you need to teach your junior, like that scenario you can be given. And the third scenario is that's the most often given in the surgical module, simulated patient task module. And often you guys will be familiar with such type of module. Now, before ending, it's a very important for part 3 examination to regularly practice. You can practice with anyone, best if you have a peer, someone who is also preparing for the part 3 examination. You have that is the best scenario. Otherwise, you can try it with your partner. Another very good way to prepare yourself is to talk in the front of the mirror and record yourself. Or you can do with your cell phone also. Record yourself, and the important thing is to listen to that. When you listen to that, you can identify so many things, like how many times you are saying okay, how many times you are saying the similar words, where you are getting stuck. So you can identify those things are very important for fluently speaking. Now, for surgical module, it's a very important to approach surgical station and effectively and navigating it successfully, especially in cases of the surgical prioritizing the surgical theater skills. And for the patient simulated patient task, it's you always need to aware of the basic things. You don't need to tell the details of the surgery. You need to assess the preoperative risk assessment. You need to check the patients have understood regarding all the procedural risk benefits and the alternatives and methods available are not. So if you can go through the basic things, you will be definitely scoring high. It's not an rocket science of passing the part 3 examination. Prioritizing patient safety is often the key area where the college gives you the marks. Now, it's also important for part 3 examination, you need to seek feedback. Either you can perform some station and provide me in the group so I can provide you the feedback. This will be encourage you also, and you can identify your mistakes as well and where you are lacking also. So practice regularly, revise the guidelines if you need, join a group study discussion for clear communication and effective way and professional way of delivering your message to the patients. These are the key points here I wanted to highlight in this core surgical module. Thank you everyone for joining here today. I hope you have enjoyed this session.